Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. He's back. Dr. Geoffrey is back every year. I have him come on. We talk about cold and flu season. During the pandemic, you were instrumental in helping me explain to people what was going on, what you needed to do, gave some great advice on how to stay safe during COVID. So welcome for, I can't even tell you how many years it's been, but welcome.
Thank you, and thank you so much for having me back again. I'm always looking forward to coming back to your show.
Thank you. So we're entering cold and flu season, and now it's a little different than it was before, because not only are we dealing with cold and flu, COVID is still around. Mm-hmm. Did you think COVID would still be around? When we talked about this a couple of years ago, did you think COVID would still be around in 2024?
I did, and you're right, it's cold and flu and COVID season, and that's what's going to be moving forward. And the reason why I thought it was going to be around is because COVID is a respiratory virus, just like the flu. And so given that we never really get rid of the flu, also known as the influenza virus, COVID was going to be here for a while. What I am pleased about is that it's not causing the type of havoc it did previously. That does not mean that they're not deaths, but it's just not as many as we were experiencing previously.
Why isn't it wreaking havoc? Why isn't it more dangerous now than it was back then?
Because remember back then, people were talking about this herd immunity. Now we have a level of herd immunity. That's one. Two, many people have seen it in one form or the other, meaning they've either been infected or they have been vaccinated, which means that when you get infected or infected again, you already have antibodies for it, so your body's ready to fight it right away. And then finally, we have different variants, and these variants that we're getting are not as bad as the novel first one.
Should we still be wearing masks?
That's an interesting question. If you ask many type of health people, they'll give you a bunch of different answers, and that's a resounding yes. A yes with a caveat. If you are not a mask person or you don't feel comfortable, then at a minimum, always have a mask with you. Why? Because if you are at that movie theater and that person next to you is coughing, that's the time to put on a mask. So the question, the answer is always have a mask with you.
What about washing your hands? Remember, we were washing our hands 5, 10, 50, 20 times a day. Should we still be washing our hands as often as we used to?
Yes, and especially during this cold and flu and COVID season, because what we do know about the flu for sure and the cold is that if someone sneezes on a surface and you come by and touch it, and then you touch your mouth, you can contract it that way. So washing your hands is still key.
Because I still, like when I go in the Giant, I still see people with masks on. I still find myself washing my hands more often than I did pre-COVID. It's like you kind of got into these grooves, got into these habits, and it's kind of hard to break them, and I think it's a good thing that we don't break them. So this is for, you think, for life? We're gonna always be dealing with this COVID and in different strains?
Yep, we're always going to be dealing with COVID because similar to the cold, similar to the flu, we don't have a cure for any virus. People don't realize that. We have treatments that will decrease the symptoms, or we have preventive measures. But in terms of a cure, we don't have a cure for any virus. Let's use COVID. We've all heard about the Paxlovid. It doesn't treat it. You're treating the symptoms of it. So you're making it less likely to be fatal or less likely to cause severe symptoms.
If you've had COVID more than once, does it weaken your system? Let's just say, I have a son, Lord knows, I can't even tell you how many times he's had COVID. Does that weaken your system in the future? Will we see cases in the future where because this person had COVID more than once, it weakened them so other types of things can come through?
Let me reframe it this way. What the studies are showing is that every time you contract COVID, it's a health insult to you, which may have a long-term effect. The younger you are, from what we understand, the younger you are, you can probably deal with it. You can probably work past that impact. But the older you are, it's a greater impact. For instance, each time you contract COVID, it increases the likelihood of you developing diabetes. If you're older, it increases the likelihood of you developing Alzheimer's at an earlier age. So there's all types of long-term consequences. So every time, view it as a unique health insult. Whereas with, say, the flu or the cold, the way we understand it is that you get the cold and it's over and you're fine. There are no long-term consequences to it. And so COVID, the studies are still on, but it's turned out that it's a health insult. One more example. Every time you get COVID, it puts you at risk for a pulmonary embolus. A pulmonary embolus is a clot that we can develop that, if not treated, it can.
Wow. Well, let's talk about what are some of the natural things we can do to help with resisting getting COVID. Of course, wearing masks, washing your hands. Are there vitamins, for example, that you can take that will help you along the way with that?
Yes, there are vitamins, the number one being vitamin D. And the reason why vitamin D is so important is that there is an immune receptor, a vitamin D immune receptor on every single cell in our body, especially our immune cells. And so if you don't have enough vitamin D, those cells are not functioning maximally. And studies have shown that people who are vitamin D deficient usually have worse outcomes. And there's another study out of London that shows those who are vitamin D normal were less likely to contract COVID. So vitamin D, number one. But as it relates to that class of respiratory viruses, vitamin C has been extremely helpful. Why? It decreases the duration, it decreases the symptoms as well. Zinc, elderberry, echinacea, all those are helpful in the prevention, as well as if you get it, it decreases the duration and it decreases the severity.
So should you do that year around, or should you just do it this time of year? Is that something you should just put into your regular vitamin regimen? I'm a vitamaholic. I've always been, me and my mom. But is that something you should be doing all the time, or something just this time of year?
You should be doing it all the time, but you should be especially diligent during this time of year. I mentioned zinc. Zinc is not a long-term play. You usually get enough zinc in your diet if you're eating a normal diet. But during this type of year, during this time, you want to make sure that you take something that has a zinc supplement. Because again, it decreases viral replication, and zinc is involved in the development of the immune cells of our immune system. And what we do know is that we're going into a high viral season starting about right now.
Yes. Well, let's talk about the flu. Why should you make sure you get your flu shot every year?
Well, the flu shot, it is key because for people who are healthy, if they contract the flu, they will be just fine. They'll have some symptoms: cold, cough, headache, chills. They'll feel bad for a couple of days, but then they will get better. However, for the very young, for the elderly, and for those who are immunocompromised, they have diabetes, high blood pressure, cancer. If they contract it, their severity is going to be worse, and they may wind up hospitalized. So to your question, by people getting a flu shot, it makes it less likely for them to contract the flu, and therefore they're not able to pass it on to someone else.
Can you get the flu and COVID shot at the same time?
Yes, you can.
Because I hear people say, I'm afraid I'll get the symptoms. I'm going to feel sick if I take the flu shot and the COVID shot at the same time.
Well, I'm going to add one. You can get the flu, you can get COVID, and if you're over 60, you can get RSV as well, all at the same time. And so if you're already there, you might as well get it done then, because during this period of time, we've already talked about COVID, we've talked about the flu, RSV is out there.
What is RSV?
So RSV is respiratory syncytial virus. That's a respiratory virus that it impacts kids. It also impacts people who are over the age of 60. And if it infects someone over the age of 60, it's more likely that they're going to have more severe symptoms. Where if it happens to kids, they may develop a horrible cough. But for people who are between the ages of 12 to about 60, if we get it, we're going to have cold-like symptoms. So the point is, the older you are, the more at risk you are of having negative effects from RSV.
Doc, years ago we weren't talking about RSV. Where did this come from?
That's very interesting because RSV has been around for a while, but it's only been the last 15 to 20 years that we've noticed there's a segment of the population that it's impacting worse, and it's those 60 and older and those who are immunocompromised.
Wow, because just recently I've been, and it's through these commercials, you hear them every other commercial, these commercials, and I'm like, okay, so what is this thing?
Yeah. It's an upper respiratory tract infection that can, if it progresses, it can develop into pneumonia, it can develop into bacteremia, which leads to like sepsis. It's one of those that if you have a vaccination for it, take it, because you can decrease negative effects greatly.
So let's go back to the flu a little bit.
Okay.
Should we be wearing masks to prevent that as well?
Yes, and let me tell you why. Do you know our fewest number of flu cases came when?
Interesting, COVID.
During COVID. Why? People would say, well, because we weren't around each other, and that's a part of it, but because we were always masked up. Flu is a respiratory virus. We get it from respiratory droplets, being around someone who has it, or from fomites, meaning someone sneezes and you touch it and you bring it to your mouth. So wearing a mask will greatly decrease the likelihood of you contracting the flu.
Do you know during COVID, I didn't catch a cold?
Because you had that mask on.
And so then once I caught a cold, I was like, what is this? Mm-hmm. Because it had been so long, and that is such proof that worked.
Right.
For that period of time. Is there any particular, now that we're kind of out of that COVID groove, is there any particular mask? Do we have to wear those heavy ones that we used to wear? What would something 95?
N95.
Yes, and or can we just get the little, have a little paper mask when we go into to church? If you're going to a large church and there's a lot of people there, or going to a concert, things like that. Does that matter now?
Well, great question. A regular standard surgical mask should be just fine. However, in my practice, or in my personal practice, I carry 2 of those because if I'm with someone and they got a slight cough, I may put that mask on. But if they're just hacking away and I'm really worried, I double it up and try to move. And so having a mask handy is key. I found that some people, they feel comfortable walking around with a mask all the time. Many people, that's not the case. They would prefer not to walk around with a mask, especially young folks. So the way I advise my teenagers is, hey, if you're not going to wear it, but just have it with you just in case. And both of them have admitted, Daddy, I'm glad that I had that mask because such and such a person was just coughing away.
So as we move forward, how should we deal with flu symptoms and vitamins for flu? Is it the same thing? Do you use the same vitamins that you would recommend for COVID? Would you use those same things for the flu?
Very similar, yes. Like the vitamin D is top of the list. Vitamin D is top of the list, and making sure that you maximize that. And the dose for that is about 10,000 units.
That's another thing. It's like you go in the store or on whatever online, and you're like, okay, so should I get this amount or this? How do you know what's the right amount?
Well, let's just set it up this way. So the more pigment you have in your skin, the more likely you are to be vitamin D deficient.
Why?
Because most of our vitamin D comes from our skin being exposed to sunlight. But because of the pigment in our skin, we're less efficient at taking in that sunlight and converting vitamin D on our skin. Not only are pigmented people, the older you are of any age, because of the skin changes, you're less efficient at converting sunlight, at converting vitamin D from sunlight. And so, depending on your age, you may need more vitamin D. Also, during this time of year, where there's less sun anyways, you're going to need more vitamin D. And if you are a person who's not pigmented, but you use sunscreen, you're not making enough vitamin D as well. And just so you know, the normal level of vitamin D in our blood is about 40 to 60 micrograms. That's equivalent to about 8,000 units. 8,000 units. Well, you say, well, why do I recommend 10,000 units? Because when you take a vitamin, 100% of it is not absorbed. Only about 70 to 80% of it is. So just by taking 10,000, it just puts you at the normal level for vitamin D.
Now, do you recommend taking all of your vitamins together or separating? Like if you take 6 to 8 vitamins a day, do you take the zinc at one time, or do you take the vitamin C during the middle of the day? How do you do it to make sure it's the most effective?
Right. So for the vitamin D, I'm glad you mentioned those. For the vitamin D and the vitamin C, I would take those early in the morning or take them when you get up. As it relates to the zinc and the elderberry and the echinacea, I would get a 6-in-1 blend, and you can take that in the morning too. But what's key is you want to take them daily. Some people say, oh, I just want to take it once a week. No, you want to take them daily, especially vitamin C, because that's a water soluble, which means as soon as you take it, you're going to excrete it within 24 hours.
That's what I was going to say. Well, aren't we just going to urinate it out?
You're going to for the water soluble ones, yes. And studies show that as it relates to vitamin D, which is a fat soluble, it's much better to take it daily than to take it weekly. And then the elderberry and the echinacea, you want to take those daily as well. And again, this is the most important time of the year to be compliant with your vitamin regimen.
How do you know whether it's safe to mix a vitamin with a certain medicine you're taking?
Yep.
How do you know whether it's safe to do that? Or how do you know with the elderberry, if you're using the syrup, the elderberry, say that it's not going to, if you're a diabetic, cause your blood sugar to spike?
Well, the elderberry syrup, it's got about 5 grams of carbs in it, so your blood sugar may go up. But in terms of a spike, it should not go up much, not enough where you need to take insulin. However, if you are experiencing that, then you should definitely talk to your primary care doctor. Now, there are some vitamins that you don't want to take with certain medications. For instance, potassium. That's a vitamin that you should not be taking at all unless your doctor recommends it.
Why?
Because potassium can be cardiotoxic to the heart, which means that if you take too much of it, and you should not be taking it, it can cause your heart to go into a funny rhythm. Again, potassium is not one that you should be taking unless your doctor tells you. Well, you say, well, I know I get muscle cramps. I know my potassium's low. Bananas, cabbage, orange juice, those are all rich in potassium. It's impossible to overdose on potassium just from foods as long as your kidneys are just fine.
How does diet work into making sure you stay healthy this time of year?
Diet is everything. Diet is everything. And the top 3 that you want to stay away from are processed foods, are processed meats.
Give us an example of processed foods.
So processed meats would be bacon, salami.
All the good ones.
All the good ones. All the good
All
ones.
the tasty ones. That's the ones you have to stay away from. Go ahead.
And they have a lot of nitrates in them. And so that creates issues. And then the processed foods like potato chips, pretzels, those have high fructose syrups.
Go ahead.
Those have high fructose syrups. Those are not good for you because that can lead to insulin resistance. And then if you throw in there those high carb sodas.
I tell my kid, just one of them, I tell my son, stop drinking all those sodas. Young people, it's like, that's a meal.
It's a meal. It's a meal, but you should add in there those 100% fruit juices as well. That's what tricks kids, or tricks people. It says 100% fruit juice. But when you get down to it, it's only about 1% fruit juice. It's the rest of the high fructose corn syrup and so forth and so on. And so you've got to be careful. And those foo-foo drinks that we get at many of these coffee houses, that's a whole meal.
It is the macchiatos.
Oh.
And they are truly delicious.
Right.
But sugar.
You're key. Your diet plays a role in your immune system. And we talked about this earlier. Your sleep plays a humongous role in your immune system.
And that's the question too. How much should you be getting, especially this time of year, especially the older you get? how much sleep should you be getting? And I am a witness of how, if you're not getting enough sleep, how that can really impact your day.
It can impact your day and it
And
can
your
impact
health.
your immunity, yes. So studies have been clear and consistent about 7.5 hours every single night. When you get above 9, it's no longer helpful. Why 7.5? Is because it gives your sleep cycle a chance to go through about 4 times. You need 4 sets of 90 minutes. And what that does is it allows your brain to restore. It allows your immune system to restore and rest. And it's a period of time that your body gets to rebuild for any injuries or any deficits. So it is extremely key for you to get enough sleep.
You know, I was telling you earlier when we were off air that I just retired from WTOP, and I did a lot of overnight shifts. And you can tell that it really, after years and years and years, and my mother worked the overnight shift as well, all of her years as a nurse's aide, it really can impact getting that mixed sleep. You get 3 hours here, 3 hours here, maybe 2 hours there. Sometimes you do, sometimes you don't. It can wreak havoc on your immune system.
You are so right. People who work those shift hours, because I do them as well, it's a temporary insult on our immune system. It causes a transient decrease. You just hope that during that transient decrease that you're not exposed to a virus or to a bacteria.
You know, I also want to fit in exercise. How much does that impact your health and how you feel, especially this time of year? We're starting to come into that season where you can't get outside if you're a walker or a runner, where it's hard to get outside to do your exercise. How important is that as we come into this cold and flu season?
It's extremely important. You would know from your Zumba
Yes.
classes, you would know from working out, which is why you're so healthy, but it increases our white blood cell counts. While you're working out, it causes an increase, and that increase lasts throughout the day. It increases your metabolism. It also forces you to drink more water, which helps you detox. Helps you detox. So water is very important to your immune system as well. It does a few different things. It helps your liver function maximally. It allows your kidneys to function maximally, and so therefore it detoxes a lot of that's in your system, and it helps with your bowels, which is a detoxification as well.
You know, I have a fight with my sister all the time. She's like, I don't like the way water tastes. You know, or she puts those things, I can't stand them. She puts those little flavor things in her. How much sugar does that have in it? You know?
Yeah.
It's like, but you've got to drink. It is so essential to your health, is making sure you get, but how much? A lot of people, how much?
Okay, assuming you don't have renal failure, assuming you don't have heart failure, for women, they should drink anywhere from 8 to 10 16-ounce bottles of water a day. For men, they should drink anywhere from 10 to 12 16-ounce bottles a day. That's just a regular day. You add working out in there, that amount increases. And you are so right. Water is the best way, just free, regular water. But if you've got it, I would much rather you add something to it than to not drink it at all. But sometimes try putting a little lemon juice in it. Try some cucumber. Put some cucumber slices in there. You know, but free water is key.
Free water.
Yes.
As we're wrapping up the program, what do you want people to know most about cold and flu season?
What I want people to know most is that you don't have to get it. You do not have to get it.
Because we think we have to. Okay, I'm going to get the flu.
No,
I'm
you're not.
going to get a cold.
No, we talked about a lot of things that you can do: hydration, sleep, and keep in mind there are vaccines out there. There's the flu vaccine, there's the COVID vaccine, there's RSV, and if you do have flu-like symptoms, the reason it's important for you to get tested, because if you're flu positive and if your symptoms start within 48 hours, there's some medicine that we can give you called Tamiflu. It's an antiviral that will decrease the severity and that will decrease the duration. Same with COVID. If you have COVID and you test positive, there's some medicine that we can give you that as long as you get this medicine within 5 days, then it can decrease the severity, it can decrease the duration as well. So getting tested, it has its benefits.
Now, each year the strain of flu changes. That's why the flu vaccine
Yes.
has to be. How does that work? So do you know from year to year whether it's going to be a bad strain, or how does that work?
So they test the flu around the world. So we already knew what strain was like coming here. So we created a vaccine for it. And as it relates to how bad it's going to be, we usually don't know how bad it's going to be because we have prepared the vaccine. The question is, how many people are being vaccinated? How often are they being exposed? So a lot of it has to do with the community. That's why you hear that in Michigan the flu's bad, whereas in Maryland it's fine. It's all about the community and the culture of what's going on.
Is that the same with COVID? The strain keeps changing?
The strain keeps changing.
How often?
We're seeing that with COVID, it changes a little faster. So whenever you hear about a new vaccine for COVID, that should register as, okay, the strain has changed. And fortunately, it's changing slow enough that we're able to keep making vaccines for it. Again, COVID's going to be here. It's going to keep changing. But the goal is do what we can. Mask up. Stay out of these environments that people are coughing. Wash your hands. Get plenty of sleep, plenty of rest. And you don't have to contract COVID, the flu, or RSV.
So what, and once you do, if you have contracted this, as you said, there are things that you can do to reduce the symptoms, and you can be just fine. And make sure you're eating right, make sure that you are drinking your water, make sure that you're getting enough sleep, you're not staying up at night, binge watching Netflix.
Right, and your vitamin C. In fact, one of my favorite brands is Shield Vitamins. They come in 5,000 units, and then Shield Vitamins has a 6-in-1 that has elderberry, echinacea, zinc, vitamin C, vitamin D. So supplementation, as you mentioned early on, year-round is key, but especially during this high viral load season.
And you can't take it 1 week and say that's enough.
No.
Yeah, you got just like the COVID shots you got 2 years ago.
You should have had like 6 by now.
Exactly. So the amount of vitamin C and vitamin D.
So vitamin D, you should be taking about 10,000 units per day. Vitamin C about 500 milligrams per day.
And what if can you get the kind that doesn't upset your stomach?
Yeah, so the gummies are the best ones. That doesn't upset your stomach, and people are more compliant because the gummies taste better. People look forward to it. So the gummies is the one that I recommend to my family.
Okay, I never knew that gummies are the ones that don't, because if you're taking, I've had that myself where I feel a little stomach upset.
Right.
So I'm going to the store to get me some gummies. Dr. Varner, it has been a pleasure, and I hope it's not a whole nother year before.
Let's not. No, I don't want it to be a year. I am looking forward to coming back.
All right, you've been watching the Sisters for Fitness Wellness Show with Dr. Geoffrey Mount Varner, Dr. Geoffrey, health expert. Thank you for joining us this morning. I'm Stephanie Gaines-Bryant. Have a great day.